Good morning once again, students. Today I come to you with my series again. We are coming to discuss about eyelid anatomy. As you can see projected on the screen, this is the eyelid that we all have. Okay. Before we delve into the proper anatomy, you should know about the functions of the eyelid. You should know that it regulates how much light enters into our eye. For example, if a very bright light is uh, being thrown at you, you partially close your eye. So it protects, it regulates how much light enters the eye. It also protects the ocular surface. When something is coming towards your eye, there is a reflex which automatically makes you close your eye. So it protects the ocular surface. It also spreads the telephone uh, whenever we blink. There's positive pressure from the lacrimal gland on the lacrimal gland from the eyelid, and tears are produced on the surface of the eyeball. So, apart from that, it helps to release tears onto the ocular surface. Okay, so these are the major functions that the eyelids have. So, remember that as you see the eyelid like this, it has several portions, of course. This is the upper eyelid, and that is the lower eyelid. These are the eyelashes which are found at the margins of the eyelids. Okay. At the far corner here, you have what you call the lateral canthus, and this is the medial canthus of the eyeball. Okay. There's some measurement that we should know about. The aperture or the opening between the upper and lower eyelid measures 8 to 11 millimeters vertically, and horizontally it measures 27 to 30 millimeters. That is the palpebral fissure. Okay, that is the height, and that is the width of the palpebral uh, fissure. So I was talking to you about how the eyelids help in spreading and producing tears on the surface of the eyeball. When we blink anytime, this is the lacrimal gland. The pressure from the eyelid creates positive pressure on the lacrimal gland, brings out tears which is spread evenly upon the ocular surface. Okay. Additionally, bear in mind that within the eyelid we have the canalicular system. Okay. This is punctum. Getting to the medial side, this is punctum, inferior punctum. There's a superior punctum. That all the tears that are produced from the lacrimal gland, they are collected into the punctal system. Then they go to the horizontal canalicular system. Okay, in about 80% of the general population, we have what we call the common canaliculus before it joins into the lacrimal sac. All right, so those are some of the details that are also found within the eyelids. All right, let's talk about certain muscles that are found within the eyelids. We have the orbicularis oculi muscle, which are joined into several concentric layers. All right, there are two main types of the orbicularis oculi muscle. We have the orbital, which is a bit deeper into the orbit, and the palpebral, which is found around the eyelid itself. So, the orbital one, the major function is involuntary. Is involuntary. What is the function of the orbicularis oculi muscle at all? It helps in eyelid closure. It helps to close the eyelid. So the main function of the orbital type is involuntary, whilst the palpebral one is voluntary. Even the palpebral one, if side divide, is also divided into two major parts. We call it the preceptor and the pretarsal, which is not well illustrated here, but they are called pretarsal and the preceptor. orbicularis. Okay. All right. So other muscles that we can find in the eyelid are the what? Levator palpebrae superioris muscle. Okay. It helps to open the eyelid. And of course, we have the what? Look at the superior tarsal plate over here. Okay. There's also inferior tarsal plate. Okay. When we talk about the tarsal plate, it is that particular portion of the eyelid moving from the lid margin up to a crease, okay, from the margin up to what? A crease, and then that is what the tarsus is all about. It's also important for you to know that you have fat part within the eyelid, the medial and the lateral fat parts, okay? And after that, then you have the what? The orbital septum. The orbital septum, okay, is also found in the eyelid. It prevents spread of infection, okay, into the orbit. Well, so it's important to learn something very vital when you're talking about the eyelid anatomy. For example, this is an eyelid, okay? We usually call it gray line. Gray line. Look at the gray line here. This is a gray line, okay? The gray line constitutes the most superficial portion of the orbicularis oculi muscle. I repeat, the gray line constitutes the most superficial portion of the orbicularis oculi muscle, and as the name denotes, is gray in color. It's important to know that the eyelid has been divided into structures found in anterior lamellae and those found at posterior lamellae. So we have anterior lamellae, and then posterior lamellae. What are the structures there? It's very important to know which structures are found in each lamellae, because when there's eyelid injury and there's the need for reconstruction, in order to get the anatomy properly aligned, one should be in good knowledge of so far as the anatomy of the eyelid is concerned. So, which structures are found anterior to the gray line? Anterior to the gray line, one, we have the orbicularis oculi muscle, okay? The orbicularis oculi muscle, all right? Yes. Anterior to the gray line, two, we have what? The eyelashes. We have the eyelashes, okay? Now, let's talk about, so anterior to it, remember that at the root of the eyelashes, there are two major glands. The gland of Zeiss is found here, as you can see, and of course, we have also gland of mole, okay? Gland of Zeiss and gland of what? Mole. More specifically, the gland of Zeiss that are found at the root of the lash follicles or cilium, all right? So, the structures which are found posterior to the gray line include, one, we have what? The tarsal plate or the tarsus. Okay, the tarsal plate or what? The tarsus. This is the tarsal plate, also known as well the tarsus. All right, I'll show you now the slides. It's better seen over there. So, the tarsus contains what? The Meibomian gland. Okay, and of course, posterior to the tarsus, you have what? The palpebral conjunctiva. Okay, so I repeat. In summary, anterior to the gray line, we have what? The orbicularis oculi muscle, the eyelashes, gland of Zeiss, gland of mole. Of course, the skin is there. And posterior to the gray line, you have the Meibomian gland, its orifices, okay, these are found here, the conjunctiva, and of course the mucocutaneous junction. That is the junction between where the conjunctiva ends and where the skin begins. So Those are some of the important anatomical details that is good that we know about. So let's take advantage of this picture to learn about certain characteristics of the eyelashes. Okay, we have the upper eyelashes and then the lower eyelashes. Okay, sure. So the upper eyelashes are more numerous and more pigmented as opposed to the lower eyelashes, which are less in number and less pigmented. So the upper ones are more numerous, more elongated, and more pigmented, but the lower ones are less in quantity, less pigmented, and less elongated. Okay, so those are the characteristics of the eyelashes. So as we said, there's also canalicular system here, okay? The pantum, inferior pantum, superior pantum, okay, the canalicular system. These all help in what? Tear drainage, okay? So that is it. Um, it is, yes. So remember that, let me talk about the meibomian glands to you again, okay? Meibomian gland, when we talk about eyelid anatomy, they are of so much importance because it produces certain lipids that help in forming the tear film. So there is difference between the meibomian gland found in the upper and those found in the lower eyelids. Okay, in the upper eyelid, the meibomian glands there are about 30 to 40 in number, whereas in the lower eyelid, the quantum is about 20 to 30 meibomian glands. Okay, so I would like to show you the normal position of the eyelid, the normal position of the eyelid. If you look at this particular picture, okay, you realize that the limbus is the zone between the conjunctiva and then the cornea. The zone between conjunctiva and the cornea, or it's also said to be the most peripheral portion of the cornea. Alright, so this is the limbus. This is the limbus. Alright, the upper lid should lie in the young people at the superior limbus. At the superior limbus, but as we age, it's normal to find it 1.5 or 2 millimeters below the superior limbus. I repeat, the upper eyelid position should be in the young people at the superior limbus, but as we age, in other words, in older people, it's also normal to find it 1.5 to 2 millimeters below the superior limbus. So, what is the position of the lower lid so far as the limbus is concerned? It should lie just at the border of the limbus. It should lie at the inferior limbus. Okay, so we will in future learn about certain diseases that can be found within the eyelid, but for today, let us concentrate on just two particular diseases that may happen. Well, for your information, okay, remember that the orbicularis oculi muscle, which helps in closure of the eyelid, is innervated by the seventh cranial nerve, also known as the facial nerve. At the same time, the muscle which helps us to open the eyelid, okay, is what? The levator palpebrae superioris muscle is innervated by the third cranial nerve, also known as what? The oculomotor nerve. So let us notice this, that when there is facial nerve palsy, okay, tubicularis cannot close the eyelid very well, and so that there's what? Exposure. You see, the patient tried to close the two eyelids, but because the lid in the left eye could not close well, okay, it has left some portion of the eyeball showing. So we call it what? Lack of thalamus. Lack of thalamus. So difficulty in closing the eyelid is known as what? Lack of thalamus, and it could be caused by severe cranial nerve palsy. Again, remember, look at this chart. I told you that in young people, all right, the eyelid should be at the limbus, superior limbus. The position of the upper eyelid should be at the superior limbus, or as we grow, it can be found 1.5 to 2 millimeters below the superior limbus. Look at the case of this particular child. The eyelid is found almost mid-cornea. Okay, it means the eyelid has drooped, it has lowered, it has come down. So eyelid drooping is known as what? Blepharoptosis. 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 Don't say ptosis. Okay? Don't just say ptosis. Ptosis means descents, lowering, okay, or drooping, partial or totally off an organ or part of the body. But when you add that thing about blepharo, it makes it ophthalmological. So say blepharoptosis. Ladies and gentlemen, there's a lot to learn so far as the eyelids are concerned. We will learn about its pathologies in subsequent classes. But today, we just learn about the anatomy, and I just wanted to sensitize you on difficulty in closing, and then difficulty in what? Opening the eyelids with blepharoptosis, and of course, the lack of thalamus. So, imagine this patient stays like this for a while. The eye will be exposed to the environment and can develop a lot of infections and diseases. So in subsequent classes, we'll talk about diseases that are associated with the eyelid. And I bring my class to an end. Keep learning. Gather questions if you have any. You can clarify them with me in class. Until I see you again, stay tuned. Okay.